Alright, so today we're going to be talking about the 5 different types of shock. Shock in its most basic terms is basically hypoperfusion. And when you write hypoperfusion out, you'll see the prefix is hypo. Hypo in medical terms means too low. So when we're talking about hypo, it's too low. In perfusion, perfusion basically is the necessary nutrients that the organs and tissues need, and it's the exchange between the blood and those nutrients. So when we're talking too low of those nutrients, it's going to put you into shock. The 5 different types of shock we have are hypovolemic, distributive, obstructive, cardiogenic, and metabolic or respiratory. I'm going to first start talking about what's called hypovolemic shock. Hypovolemic shock basically means there's not enough blood or fluids in your body. Once again, you see the prefix hypo meaning too low, and volemic dealing with your fluids. Hypovolemic shock usually is going to occur in one of two ways. Either you're going to have hemorrhagic or non-hemorrhagic. Hemorrhagic would be too much blood loss or blood loss in general. So hemo, the prefix, I mean, when you break these words down, it's like another language. Hemorrhagic is too much blood loss, or non-hemorrhagic. The most common non-hemorrhagic shock would be like burns. So if you have a burn and you have severe fluid loss, that is not blood. Alright, so the next type of shock we're going to be talking about is distributive shock. Distributive shock is caused from systematic vasodilation. What that basically means is if we have a normal blood vessel, our blood vessels are going to be dilated and they get larger, and the amount of fluid in here is actually the same, but when you put the same amount of fluid in a larger blood vessel, it only fills up, let's say, about halfway. This systematic vasodilation is going to lead you into actually not losing the fluids, but the fluids leaking out into interstitial spaces. Therefore, you will go into what's called distributive shock. The third type of shock is obstructive shock. Now, obstructive shock, you have adequate fluids in your body, whether it be blood and others. You have your blood vessel tone is perfectly fine. It's not dilated or constricted, but what's actually happening is there's some kind of obstruction within those blood vessels. It can cause great resistance, therefore leading into obstructive shock. Some common causes, or some common obstructive shocks are from embolisms, pneumothoraxes, as well as tamponadic.
Alright, so next we have cardiogenic shock, and this is caused from heart abnormalities, such as at birth, such as a mutation that causes your left atrium or right atrium to have pump malfunctions. Also, there are other reasons such as a myocardial infarction or CHF, and these heart abnormalities or mutations cause for inadequate pump or blood flowing throughout the body. Next we have metabolic/respiratory, and this is caused by inadequate oxygen perfusion to the whole body and or some type of metabolic abnormality such as a thyroid issue. And this causes problems because you're getting decreased nutrients to your body, such as the necessity of oxygen to continue the metabolic cycle, such as the citric acid cycle. And for all these types of shock, as a basic EMT, we can't really do much, such as put IVs in or administer any medication that will immediately save these patients. One thing that we can do possibly for metabolic or respiratory is assist with EpiPen injections, and that may reduce the risk of shock occurring. But overall, you just want to assess the patient's airway, breathing, and circulation, along with trying to do your basic care such as C-spine and other things of that nature. Alright, so another thing that you also want to do, such as hypovolemic, where it's hemorrhagic, if there is severe bleeding, you want to tourniquet it and or apply gauze to stop the bleeding. And you want to recognize and report what type of shock is potentially happening. You don't have to be 100% right, but you should have some information and or skills that let you recognize which of the 5 shocks it may be. And then you would like to call medical direction and let them know that, hey, I suspect this type of shock, have this particular item ready, such as an pericardial tamponade. You want to have that 60 cc needle ready to help decompress the heart.